The most common symptom for thyroid cancer is actually just a painless lump in the neck. Not in the throat, not a swallowing lump, but a visible lump in the neck. It's oftentimes picked up on routine physical examination by your primary care doctor, by anyone else who might be examining you. Or in men, maybe they're shaving and they feel it. I think there was the TV show, the Fixer Upper, or the Flip This House, where a nurse noticed that on the guy's neck he had a lump, and so they called the station. He ended up having it evaluated, hadn't had neck cancer. I mean, had thyroid cancer. So it's oftentimes just a painless lump that you either feel yourself, someone else notices, or your primary care doctor notices. We then get a needle biopsy of it, what's called a fine needle aspiration, and if it comes back as a cancer, most commonly it's papillary thyroid cancer. And then the treatment for that is to remove the thyroid gland. We sometimes have to remove the lymph nodes in the anterior part of the neck, but most of the time it's a thyroid removal of the thyroid gland, followed by possibly radioactive iodine treatment, which is usually done by the endocrinologist. Pretty common. I think we're making the diagnosis more commonly because we're using ultrasound to find more and more nodules. Now, I have to tell you, there's probably a certain number of people who die of natural causes and probably have had a tiny little thyroid cancer for years and years and years. It's like the people who have prostate cancer. You know, they may go to their grave with other diseases before they die of the prostate cancer. But if it's an enlarging nodule and we make the diagnosis, then we usually end up having to treat it. For papillary thyroid cancer, at least, it's a very high cure rate, probably in excess of 85 to 90% 5-year survival rate from just doing the surgery plus or minus having radioactive iodine.